Keeping your bones healthy to prevent osteoporosis may not be at the top of your wellness list, but it should be. We spoke with Dr. Michael Hughes of Desert Regional Medical Center in Palm Springs about this preventable condition.
Osteoporosis is a disease of decreased bone strength that happens as we age from two factors. So the amount of bone that's there, or the mass, decreases, and the quality of bone that is there decreases. And the reason we care about it is because it increases your fracture risk. Most of the time people do not realize that they have osteoporosis until they fall and they have a fracture. Sometimes with spinal fractures they can notice back pain, decreased height, the classic hunching over, those sorts of things. But most of the time it is a silent thing until there actually is a fracture. If you get a hip fracture, 50% of those people who have a hip fracture will need some form of assistance to ambulate after that. And so from a social, physical, and a cost perspective, they often end up in nursing homes. There's a huge cost to that. Out of those people who get a hip fracture, 1 in 5 will die in the first year from complications due to the hip fracture.
Dr. Hughes discusses how osteoporosis is diagnosed.
The diagnosis is done with something called a DEXA scan. And this is a test that is simple and non-invasive, similar to an X-ray test, very low dose radiation. The patient lies on the table and we scan usually their spine and their hip, and we can get a measurement of their bone density and compare them to a healthy 30-year-old, generally is what it's done, so we can see how much bone that they have lost. So the mainstay of treatment is prevention. We do this by maintaining a healthy lifestyle, so adequate exercise, weight-bearing activities. We maintain adequate calcium and vitamin D in our diets. We eliminate some of the risk factors, which would be smoking, excessive drinking. Those sorts of things can help in prevention. There's definitely a genetic component, so it can run in families. And the populations that are most at risk, white women, Asian women, especially if they're thin or they have any of those other lifestyle choices with smoking, drinking, etc. So we definitely see it run in families. For those people, they should be screened at some point. Generally, it's recommended women at age 65 be screened and men at age 70 with a bone density scan. Vitamin D actually aids in the absorption of calcium. And calcium is important. It's a part of bone and incorporated into bone, so it helps make it strong. So the vitamin D helps you absorb it. And generally, exposure to the sun, 20 minutes, 3 times a week, upper chest, face, you'll get enough vitamin D. A lot of us don't get that these days because we wear our sunscreen like we're supposed to. So we don't get as much exposure, so a supplement is fine. And generally it's recommended between 400 and 800 international units of vitamin D a day. We want prevention first, and as the population ages, yes, we'll see more people with osteoporosis, people living longer. When you are young, with adequate calcium, vitamin D, maintain a healthy lifestyle, you can prevent this. If you have osteoporosis, there are treatments out now that are once a year that help increase bone mass. But that's a treatment after you already have the disease. We still want to focus on prevention more than anything.